Good morning. I'm Megan Pearson, Chief Communications Officer for Kern County, and this is our Monday briefing related to COVID-19. So today with us we have Matt Constantine, Director of Public Health. He is dialing in via video conference, so you will see him shortly. We also have our CAO, Ryan Alsop, who will be presenting here in a moment. We have our lead epidemiologist, Kim Hernandez from Public Health. And we also have a Spanish speaker if we need to do translations at the end. So we'll go ahead and get started with Matt. Matt, if you're ready, we'll go ahead and switch the video feed to you.
Good morning. I'm Megan Pearson, Officer for Kern County. Our CAO, who will be presenting here in a moment. We have our lead epidemiologist, Kim Hernandez from Public Health. And we also have a Spanish speaker. We'll go ahead and get started with Matt. Matt, if you're ready, you can go ahead and switch the video to you.
Megan, I can just barely hear you. Are you able to hear me?
We can hear you just fine.
Okay, you ready for me?
I am. Sorry, there seems to be a little bit of a delay here in our space, but you are coming through loud and clear.
Very good. Good morning, everybody. I'm coming to you remotely today. Last week, several public health employees were exposed to a COVID positive person, and we've asked that they self-isolate at home for 14 days, but to continue to work from home. Although I've subsequently been determined not to be a contact, out of an abundance of caution, I'm working from home also for the next 10 days. I want to start off this morning with the recognition that this is National Nurses Week. This is from May 6th to May 12th. It always ends on Florence Nightingale's birthday. I could not think of a better time to be more appreciative and recognize our nurses within Kern County, from our public health nurses at Public Health, to our nurses in our 10 acute care hospitals, to our nurses within our 19 skilled nursing facilities, to all of our nurses working tirelessly throughout the Kern County. I want to make sure you hear us when we say thank you. This morning, we are announcing 32 new cases that will be up on the website. We average about 30 new cases a day. I do want to provide an update on the Kingston Healthcare Center. The state has reported to the county as of May 10th that there are 46 healthcare workers at that facility that have tested positive for COVID-19. They've also indicated that there are 62 residents that have tested positive for COVID-19. And they are reporting that there have been 9 residents that have died from COVID-19. Unfortunately, that presents a significant issue in our community. That's 60% of the deaths in the county that originated from Kingston, unfortunately. As we spoke about before, the state has sent in a California Medical Assistance Team, a CalMAT team, and there are 39 members of that team on site working shifts at the Kingston facility. On Saturday, we requested 4 additional nursing staff. 3 arrived yesterday, and there's 1 more arriving today to help prop up and to ensure an adequate level of care at this skilled nursing facility. Our original request to the state was for 14 days to help provide staffing for 14 days. That expires this weekend. It is our intent, though, to ask to extend that at least another week. Kingston has indicated that there are approximately 20 new employees that are starting next week, which is good news. And finally, before I turn it over to Ryan, I wanted to provide you an update on testing. So currently there are 9 testing sites that are either live or going live this week. There are 3 state-sponsored testing sites that are in operation now. The Kern County Fairgrounds, which is open Tuesday through Saturday, 7 a.m. to 7 p.m. The Mojave Veterans Hall, which is Tuesday through Saturday, 7 a.m. to 7 p.m. And then the 5th District drive-through at the Prado Senior Center, which is Sunday through Friday, 8 to 2. Then opening up tomorrow is a site in Arvin. It's 204 Hill Street in Arvin. They'll also be operating Tuesday through Saturday, 7 a.m. to 7 p.m. We've also been working on some county-sponsored sites and 5 sites that we open this week. The difference between the county sites is that there is no screening criteria. In all locations, though, it is free. There's no cost to the person. We are going to open up a site in Oildale in partnership with Good Samaritan Hospital. It'll be a drive-through at the north of the river Veterans Hall. It should open up tomorrow, and it should be operating 8 a.m. to 8 p.m. We also are contracting with the Westside Healthcare District in Taft, which we hope to be operational tomorrow, and they'll be open Tuesday through Saturday. We also are finalizing our agreement with Delano, with Delano Regional Medical Center. We hope that opens on the 13th. And in Kern River Valley, the Kern Valley Hospital, we're still finalizing days and hours, but we hope that will open up this week. And then finally in Ridgecrest Hospital as a drive-through. We're hopeful that those hours and times will be available soon, but we hope that they are open up this week also. As the number of testing sites increases, we want to make sure that we provide the public with all of the information they need to know. So there is a link on the county's website that will walk you through all the details, the locations. There will eventually be a map up. It will connect you to the portals to make appointments in advance. So as we expand these locations and the opportunities, we want to make sure that website is available so the public has access to all the sites so that they can make an informed decision. Megan, with that, I think I'll conclude my comments and turn it back to you and Ryan.
Awesome, thank you, Matt. Now I'm going to introduce Ryan Alsop, our Chief Administrative Officer.
You ready to go? Thanks, everybody. Happy Monday. It's good to be here. I appreciate being with Matt this morning. Just some quick notes on the governor's transition plan. He's moving all businesses statewide through the various stages of his plan. There are numerous stages. We are in stage 2. He has moved the state from stage 1 into stage 2. There are a number of businesses that are that should be aware of this. Obviously, retail, florists were open. There are certain manufacturing facilities. All of this, all those businesses have been moved to into that reopening phase. Obviously, there are a set of guidelines that go along with reopening. Most of this is curbside, which I know I've heard from you retailers that while you're appreciative, that doesn't really work and get the job done. We are looking forward to moving into other phases of stage 2. The governor has talked about a multi-phased reopening where a bit later on he can begin relaxing some of the restrictions on some of the curbside guidelines that have been put out, and opening more businesses, reopening schools, reopening, getting restaurants back and operating again with guidance under some pretty strict operational guidelines. We're looking forward to working with the state to make that happen as quickly as possible here in Kern County. Obviously, once we go through the stages of phase 2, the governor is talking about going to stage 3. I was happy to hear him last week, I believe on Friday, talk about moving to stage 3, not in a year, not in 6 months. To paraphrase what he said, it could be sooner than a month away. That's good news, and we look forward to working with him on that. The governor has put out a list of guidance, several provisions, things that will allow our county to accelerate through these phases of stage 2 that we're currently in. Again, allowing the county of Kern, to open at an accelerated rate, even quicker than what some other counties may be doing based on regional data points, a regional variance, having to do with the size of our county, the number of data points related to COVID cases, deaths, hospitalizations, our ability to do expanded testing, our hospital capacity, among other things. We have been given that guidance last week. We're working very hard on that document. At first glance, this is a document and a set of guidance points that the county is prepared to meet. We're either prepared to meet, or we are well positioned to achieve those guidance areas, with the exception of 2 areas that have to do with the ratio of infection rate, the rate of infection, and the death rate related to our population. Without going into too much detail, the governor has put these out. These are a couple of provisions that not just the county of Kern has some concerns with, but other counties as well. Those 2 provisions currently prevent us from moving through the phases of stage 2 quicker. So what we're planning on doing is we're planning on engaging with the governor's office to let him know that Kern County wants to be given the latitude and flexibility to open. We want to be able to do it in a safe and responsible manner. We want to trust the judgment of our local public health professionals, and we want to get this started right away. We can meet most of all of the criteria that you've laid out for counties to accelerate through this process, with the exception of 2, and I've just mentioned those 2 areas. We'd like to see a little bit of evolution on that. If you could work with this governor, work with some of the other counties in the state to figure out a pathway through those 2 provisions, we would appreciate it. Kern County is an 8,000 square mile county. We're mostly rural, with distinct variation within our own county. What's happening in the city of Bakersfield, or the metro Bakersfield area, is not what is happening a 2-hour drive from here in Ridgecrest. And there are other examples in our very large county. As Matt had mentioned, we do have a congregate care facility that is entirely overseen and regulated by the state of California, that accounts for well over half of the total number of deaths in our county. Currently, it also accounts for nearly half of all the hospitalizations, based on the numbers I've seen. So these are things that we would like to work with the governor on as quickly as possible. I think that this is a responsible and thoughtful request from us to his administration, and we look forward to having some dialogue on how we might be better prepared to accelerate through these various stages. And I thank him in advance. Supervisors have sent a letter to the governor. That was last week. We talked about it, basically asking for what I just laid out. We Appreciate, again, working with the governor. We've had lots of conversation. I know our public health group and Supervisor Perez is in regular contact with the governor's office, and I thank her for that. We have an ad hoc committee that has been formed. It's 2 supervisors, Supervisor Scrivener and Maggard. Those 2 supervisors, along with a bunch of county staff, are leading discussions with industry groups here in Kern County. Our goal here is continuity of communications and planning. We want to make sure that all of our industries here understand their current position under the governor's guidelines. Again, the state of California is in charge right now. And we want to make sure our industries understand their place in the world under those guidelines, how they might be operating now, how they should be planning to operate once the governor begins to loosen his restrictions. We had a great call last week with a very large group of restaurateurs here in the county. There was representation on that call from all over the county and restaurants of different sizes and scope, and that was a good call. And follow-up with that group continues. We'll have other industry calls this week. And look forward to a call with our medical care providers. We'll be talking with all of the hospital administrators from all over the county, as well as physicians who will be joining them in a call to talk about the governor's guidance, our ability to meet it, our preparations, et cetera. So we look forward to that call. I wanted to tell all of you out there, industry, if you have a business here in town, the governor's wanting your input. He's asked for it. His administration, his Department of Public Health, they have a link that you can find on their website. It's covid19.ca.gov. covid19.ca.gov. You can go there. You can find the link to provide your input. He's asking for you to inform his decision-making on how he announces and puts out guidelines, how the state is thinking through future guidelines. They want to hear from you. They want to know about your best practices. I would encourage you to go and respond to the governor directly on that link. And if you need any assistance or you need any help finding that link, you could obviously call and get a hold of the county, the Department of Public Health, or anybody here, and we could help direct you. Lastly, before we answer questions, I've gotten some questions about the county reopening. We have been on essential staffing now for at least 30 days, probably a little bit longer. I've lost count. We're planning to that essential staffing plan. We set a date for the 15th, an end date, which would mean at first glance, well, everybody's going to be back to work on the 18th, which is that Monday. We are currently planning a phased reopening of the county starting as early as the 18th. That means that there are some businesses within the county where we will be transitioning to reopening with a little bit stronger staff presence. There will be other businesses within the county that will be slower in reopening. This is going to be a phased reopening, hopefully getting back to normal, whatever that looks like, as soon as possible. And we're going to be very smart and careful about how we do this, but we're going to begin doing that on the 18th, and we're going to be working with all of our county departments and throughout our different business areas to do this in a way that ensures the safety of the public, the safety of our staff, and ensures that we are doing the work, the important work that county employees do each and every day. And so with that, I'm going to hand it over back to Megan, who can moderate the Q&A. Thanks.
Thank you, Ryan. Okay, for our media folks who are dialed in, you can now press *6 to unmute. You've received a suggested order to take your calls in, your questions in. So we're going to begin with the Mojave Desert News. If there's any questions there, go ahead and we can go ahead and get started, and we'll direct your question to the proper individual.
Hi, this is Fiona from Channel 29, and my question is, in terms of moving to the next phase of reopening,
can you give any more detail on the projected timeline of when the county will be on track to meet those two criteria that you had mentioned that we're not currently meeting? For example, the benchmarks of no more than 1 case per 10,000 people and no deaths in 14 days.
Okay, so that's probably going to start with Ryan. That may be a piece that Matt wants to weigh in related to deaths. So we'll start with Ryan.
Hi, to answer your question, it will depend on how willing the governor is to work with us. Right now, as it stands, those guidelines are set. We've just been given them at the end of last week. Again, we're working through, there's a document that comes along with the guidelines. It's a yes or no, and some analysis and explanation that's required so that we can present that back to the state. But on those two specific provisions, I know that Kern is interested again in sitting down with the governor, and I know that there are many other counties that are that join us interested in sitting down with the governor to address those two particular areas, to find out if there is a way to change these guidelines up a bit. Again, a reminder to everybody, this initially was to flatten the curve, and flattening the curve was all about managing the rate of infection and managing the issue with hospital capacity, equipment availability, the availability of hospital staff. All of those issues have been managed very well here in Kern County. Not only do we have hospital capacity available, we do have an alternative hospital care site that's been set up at the Kern County Fairgrounds that is ready to go currently for up to 250 patients should that need arise. So the county is, I think, very well positioned, but again, this is something that is going to depend on the willingness of the governor and his staff to both communicate and to work with counties on those two provisions.
Okay, next question, Channel 17.
Hi, yes, this is Karen Hua calling. Good morning, Megan and Mr. Alsop. My question is, over the past weekend, we've seen increases in cases that are a little bit higher than what we saw at the very beginning. Like there was a spike of 60 on Thursday, 62 over the weekend, and then another spike of 26. Perhaps this is because of the new testing sites available, but if this trend of higher and higher cases spikes comes and continues, would it still be appropriate for the county to ask the governor for this greater flexibility, or is this something would this be something that the county would rescind if this spike continues?
Okay, so I think we're going to direct that question to Matt. Matt, if you could go ahead and respond. I think we have your video and audio feed as soon as you're ready.
Yes, thank you. So we still believe that although there are some days that we have greater cases than others, as Ryan has highlighted, we have instituted a number of controls to address some of these daily fluctuations. We see on average, about 30 cases a day. We have seen some days that have gone up, but in a population of 900,000, that number still remains small. That doesn't mean, though, that we don't constantly reevaluate our ability to respond, to look for any trends, to reassess our position. But I view these as expected and within reason. We look at the overall recovery rate, though, and hospitalization rates. They're still low.
Great, thank you, Matt.
Thank you very much.
We'll go to our next question. Anyone from the Bakersfield, California? Kern Radio?
Yes, it's Ralph Bailey. Good morning.
Good morning, Ralph.
You guys talked about testing. Wanted to know the county's policy on antigen testing. Is that going on currently? Is that something you're trying to bring to Kern County? And thanks to Mr. Alsop, and thank you, Ryan, for giving us more information on our deceased. We now know that a majority of our deaths came from not only a nursing facility, but one nursing facility. We have a recovery rate of 96%. Doesn't that support Dr. Erickson's herd immunity? And if you remove the deaths from the nursing facility and the one woman in Delano with horrible cardiovascular disease, don't our COVID mortality number rate mirror our influenza deaths at this time?
Ralph, we're going to have Kim Hernandez, our epidemiologist, respond to your questions.
Good morning. In response to the question regarding antigen testing, on Friday, the FDA granted emergency use authorization to its first antigen test. It is another test that is in our toolkit to continue to assess COVID-19 in our community. At this time, we are not aware of this test being offered in Kern County. Again, the antigen test, much like the PCR test and the antibody test, have uses throughout this entire process of looking at COVID in Kern County. It is another tool. We do know that when you look at antigen testing, it's a type of test that looks at proteins on the outside of a virus, and this is looking for very specific proteins, that there is a risk similar to with antibody testing of false negative results. Antigen testing should not be used to diagnose exclusively a patient with COVID-19 or to exclusively rule out COVID-19. All of that needs to be taken together with part of the clinical picture of the patient. So at this time, we're not aware that this test is being offered in Kern County. It was just authorized through FDA's emergency use authorization on Friday, but we will continue to let you know if we find that it is available here.
And don't our and absent the nursing facility deaths and the woman with cardiovascular disease, don't our current COVID mortality rate numbers parallel influenza deaths at this time of the year?
Kim, is that a question you can respond to? Ralph, can you repeat the question, please?
Now that we know that the majority of our deaths are from one nursing facility, and we know another death was from a woman with horrible cardiovascular disease, absent those numbers, aren't our COVID-19 numbers parallel with influenza deaths at this time of the year?
So we do know that there are a number of similarities in risk factors for both COVID-19 and influenza. At this time, we are continuing to see, be notified of deaths, that are associated with both illnesses. We encourage people, even this late in the year, to be cautious about flu. If you haven't had your flu vaccine, it is always a good time to be vaccinated for flu. It is another respiratory disease that could potentially be avoided or mitigated with vaccination. We are continuing to look at the deaths that we see due to COVID-19 and evaluate how they, whether there are differences between COVID-19 deaths and other deaths happening in Kern County. And at this time, while we see similarities in those risk factors, we are seeing throughout California a lot of differences in those deaths as well.
This is JC with the Bakersfield Californian. Sorry, I muted myself earlier. My question is about whether or not we really think that we have an idea of the scope of the virus in Kern County. Matt was saying that, 30 cases a day in a population of 900,000, that number remains small. But, we're opening all of these additional testing sites. we're opening them in, the Kern River Valley and Delano, places where there really hasn't been many cases reported so far. I just wonder, do we really have a sense that, it's about 30 cases a day? And how confident you guys feel in how active the virus is here locally?
So Matt, I'm going to assume that's a question for you or Kim. So we'll start with you. And then if we need to pitch it to someone here, we can.
Okay, yes, thank you, Megan. And Stacy, I appreciate your question. We are dramatically expanding our testing capabilities for a couple of reasons. One is this gives us a better picture of what's going on in the community, just as you stated. It also meets one of the criteria, one of the benchmarks for us to ask for regional variance. The concept, of course, is that if we can identify cases that are either asymptomatic or have yet to develop symptoms earlier, we could intervene sooner, and that would help limit potential spread and limit additional cases. Early on, of course, we were testing those that were very ill, likely hospitalized. We are on the other end of this now, where we're looking for those that have not had symptoms yet or not been diagnosed. So we expect to find some. I think the percentage of positives over the overall number of tests will be less than it was when we were testing those that were hospitalized. But the idea is, let's find a way to identify cases earlier and intervene earlier so that we not only get a better understanding of the scope of the virus in our county, but also to further limit its ability to transfer from person to person.
Great, thank you, Matt.
Hi there, I'm from 23. I've had a horrible echo this entire time, so sorry if somebody already asked this question, but I'm just curious to know if there are any other similar outbreaks at any other senior living facilities, and is the county concerned at all about another possible spike in COVID-19 cases during the soft opening of phase 2?
So Matt, I think that's going to be a question for you as well.
Sure. Yes, I think you've identified a significant concern we have in the county. If there's 19 skilled nursing facilities alone, as Ryan has correctly stated, these are regulated by the state. We do not have authority. We do not go in. We do not have an understanding of what's happening. The state has a COVID-19 skilled nursing facility website that does list out positive patients, positive workers, and then deaths associated. We've questioned sometimes some of the information that's on there. We are worried. We believe this is a significant issue to our residents in those facilities. We're concerned is there potential for one employee that works at one skilled nursing site to go to another? Again, we're not involved in this. So we are, though, providing personal protective equipment to the skilled nursing facilities. We have provided some recommendations on infection control procedures. But I think it's wise to review that website routinely. And I'm worried Kingston, the one in particular, we have yet to fully control the outbreak. And I do worry about how this will affect the rest of Kern County.
That's really interesting, Matt. Thank you so much. I guess I'm just curious to know, so the state doesn't communicate to you guys the actual amount of cases in those total 19 facilities? And if they do, can you share that information?
Yeah, we have the website that we reference, and you can just look that up online. The state does provide us now updates on Kingston. Our hope is that in the near future, they will provide us more routine discussion with cases in other skilled nursing facilities. We've actually been talking to the state since last week about testing all of the skilled nursing facility employees and all of the residents. Because again, we need to understand the impact that this is having, and if we could prevent another Kingston from happening, we need to jump in. So we've even offered county resources to the state to get this done. We have more calls today. Our hope is that we begin testing this week so that we can provide earlier identification.
Thank you, Matt. For our question, we're going to go to Kern Soul.
Okay, but
Hi,
I'll
this
get
is-
10.
This is Elizabeth with Kern Soul News. I just had a quick question about the testing facilities that are already open and that are going to open this week. How long are all those facilities planned to be open?
So Matt, if you want, I can answer that question, or you can take that one.
Please, Megan.
Okay. The state testing facilities are reassessed every 2 weeks to determine if they are in the correct spot, or if they need to be relocated or the hours needed to be changed. The other locations are in partnership with a whole host of local medical providers, so we'll assess those on an ongoing basis. So in some cases, there may be a 2-week timeline that we will look at for sure. Some of them we will not reassess for 30 days. It's a whole host of differences depending on the site. So there's not one clean answer as to when each site will be reassessed, but we will be looking at each of them continually to see what is the best way to meet the county's needs. Thank you. So that is all we have time for today. Thank you all for joining us, and we will be back on Thursday with another briefing.